So can we start, sir?
Yes, we will start. Yes, okay.
Good afternoon and warm welcome to everyone for the webinar on Significance of Health Humanities for Healthcare Professionals conducted by Center for History of Medicine and Health Humanities, Kerala University of Health Sciences. Since our Honorable Vice Chancellor, Dr. Mohanan Kunnamal, sir, will not be able to grace the occasion due to some emergency meeting, sir will not be available today. But sir has conveyed his blessings and given his best wishes for the smooth functioning of the webinar. So with this, I would like to take over my session like welcome address. With immense pleasure and great honor, I welcome our Honorable Vice Chancellor, Dr. Mohanan Kunnamal, sir, in his absence to this webinar session. Welcome, sir. With deep sense of gratitude and enthusiasm, I welcome our respected Pro Vice Chancellor, Dr. Vijayan, sir, to this auspicious occasion. I wholeheartedly welcome you, sir. I humbly welcome our eminent registrar, Dr. Manoj Kumar, sir, for this webinar. Welcome, sir. I'm extremely privileged to welcome our dynamic resource person, Dr. Ravi Shankar, sir, Associate Professor at the IMU Center for Education, International Medical University, Malaysia. Sir, in his very busy schedule, has accepted our invitation to deliver a talk on the suggested topic. With deep sense of gratitude, I welcome you, sir, to this webinar session. Welcome, sir. I feel really proud to welcome our eminent Dean Academics, Dr. Unikrishnan, sir. Sir is the person who has introduced our eminent resource person to conduct this webinar. Thank you, sir, and welcome, sir, for this webinar. I wholeheartedly welcome our Dean Students Affairs, Dr. Iqbal, sir, to this session. Welcome, sir. Lastly, and most importantly, I welcome all the respected participants of today's webinar who have shown great enthusiasm and interest to attend this session. Welcome each one of you. Now, in the absence of our Honorable Vice Chancellor, I humbly request our Pro Vice Chancellor, Dr. Vijayan, sir, to kindly inaugurate the session and deliver the inaugural address. Sir, please.
Respected and Honorable Vice Chancellor, he is because of certain preoccupations, and he has given all the blessings for this webinar. Dr. Santhya, who is the organizer of this webinar, the speaker, Dr. Ravi Shankar, who is associated with the Medical University, Kuala Lumpur, Malaysia, Dean Research, Registrar of the University, Dean Academic, Dr. Unikrishnan, Dean Student Affairs, then Raj Mohan sir, and respected faculty. We are the University is conducting a series of webinars subjects. We had a series of seminars related to COVID organized by Professor Raj Mohan sir, and now we are the different schools are coming forward with webinars. Probably this is the norm of this era because of the pandemic, as all of us are aware. We are getting opportunities to learn in a different, and we are now tuned. So the participation in all these webinars, I think it is better than physical meetings and conferences that we are organizing, that we were organizing last year or day before the last year. So now the participation is better, the interactions are good, and the learning has become more fruitful and enjoyable. And the hurdles of travel, without the hurdles of other commitments, we can join these webinars wherever we are, either through our laptops or through our mobile phones. So things have changed. This is not a new thing. It was there for years. This Zoom was there for more than 25 years, but we were not utilizing it. The present pandemic gave us an opportunity to utilize all these things, and we have modified our education platforms also. The education is also going on through the online platform. Earlier, we used to say that Ajaryal Padamadati, the teacher will teach 1/4 of the lessons. Now, even in the future years to come, it is online al Padamadati. The quarter of the learning will be through online, even after the cessation of COVID. That is what we learn, or we understand from the global scenario. Here, we are going to learn the significance of health humanities for health professionals. Even though everybody will agree that for health professionals, humanities is an important subject, everybody may not be knowing the exact placement of humanities, where it has to be placed, what is the exact usage of it, and how we can learn it, from what are the avenues from where we can learn humanities connected with healthcare profession. I think our learned speaker, Dr. Ravi Shankar, I heard that he is a good friend of our Dean Academic, Dr. Unnikrishnan. So after the talk, we will be enlightened, and he will take us to the next height, so that the health humanities will be placed in its correct perspective. With the permission of all of you, I am very happy to declare that this webinar session is inaugurated. Thank you. Thank you very much.
Thank you, sir. Thank you so much for your most kind and inspiring words. Now, I take this privilege to introduce our most dynamic and esteemed resource person, Dr. Ravi Shankar, sir. Dr. Ravi Shankar, sir, is an associate professor at IMU, Center for Education, International Medical University, Kuala Lumpur, Malaysia. Sir is specialized in MD Pharmacology, PGIMER Chandigarh, and a FAMER Fellow in Health Professions Education, PSG FAMER. Sir has got more than 20 years of experience and has worked as professor, associate dean, curriculum committee chair in several universities in countries like St. Lucia, Aruba, and Nepal. He was an honorary professor, University Saints Malaysia, Penang, Malaysia, and is an honorary visiting professor, Savitha University, Chennai. His areas of research interest include medical education, small group learning, rational use of medicine, pharmacoepidemiology, pharmaceutical care, use of medicine in community, pharmacology education. Sir has got more than 690 publications in various national and international reputed journals and has reviewed more than 550 articles. He has written chapters for more than 7 books published by internationally established publishers, including the Elsevier. He has facilitated health humanities modules since 2007 in different schools in Nepal and the Caribbean. Sir enjoys traveling and is a creative writer and photographer. Dr. Ravi Shankar, sir, is the right person who can deliver this topic in the most convincing and appealing way. I request you to kindly take over the session. Sir, please.
Can you hear me?
Yes, sir, we can hear you. Yes, sir.
Can you see my slides?
No, sir, the slides are not visible yet, sir.
Okay. I think, let us see. No. Okay.
Yes, sir, now we can see the slides, sir.
Okay. You can see the slides and you can hear me. I think give me a minute. 1 minute. Okay, so shall I start?
Yes,
Everyone
sir.
can hear?
Yeah. Yes, sir. It's audible and it is visible also, sir.
Okay. So let me go ahead. I would like to thank Kerala University of Health Sciences for giving me this opportunity to talk about medical humanities, maybe today to a bigger audience. I had visited, I think somewhere in February, your university, and we interacted with many of you in person. So my task today is to give an overview of health humanities and health professions education. So I plan to give an overview and then maybe try and take up a few questions. So our topic is significance of health humanities for healthcare professionals. So that's the topic on which I'm going to talk. So the health humanities and our talk today. So I'm a faculty at the IMU Center for Education, International Medical University in Kuala Lumpur in Malaysia. So this is a university mainly in the health sciences. It offers a number of programs ranging from MBBS to dental, nursing, pharmacy, MBA in health, and some complementary courses like in Chinese medicine and so many other courses. So what are our learning objectives? So at the end of the session, you should be able to define the health humanities. So that's something you should be able to do. List important advantages of health humanities in health professions education. We'll look at some teaching learning methods which we can use in the health humanities and how to study the possible impact. Because one of the challenges which comes when health humanities has to be introduced at a university-wide level is how to study the possible impact. So we'll look at some techniques which will help us study the possible impact of this discipline. So I'll start with a question, maybe I think, is medicine, nursing, allied health a science or an art? So what do you think? Maybe the audience, you can note your opinions in the chat. So do you think medicine, let's say mainly medicine or even nursing, we got maybe people from nursing. So is it a science or is it an art? What do you think it is? Yeah, anyone would like to say? Maybe Dr. Sandhya or someone then? Maybe since we know her very well. I think we discussed this before, you know. What about in your opinion?
So it is actually a health course in which if you can implement art into that, can become more beautiful to be.
It's both actually, because, you know, I think the science dominates modern medicine. That's something we know about. But medicine and even other health disciplines have a lot of the art also. So this is something Voltaire said. I think many of you know Voltaire. Yeah. So Voltaire, this is what he said: doctors are men who prescribe medicines of which they know little, to cure disease of which they know less, in human beings of which they know nothing. So what do you think about this? You know, so a lot of these things have changed. Today, more likely doctors are more likely to be women. If you look all over the world globally, over 70% of the population or 70% of medical or health science students are women. We know much more about medicines. I remember Voltaire was about 250 to 300 years ago. Our knowledge about medicines has improved. Our knowledge about human beings is still an area where, you know, it's much less than the other areas which are mentioned. Interprofessional education. So one good thing about KUHS is you got interprofessional education in your name. It's the Kerala University of Health Sciences. So interprofessional education is very much in the name. So this is a modern concept. It's a concept which was always there, but something which has become more and more important in recent days, yeah, because we got doctors, nurses, pharmacists, a lot of people working together. And it has been shown that if these people are educated together, it's more likely that, you know, they will be in a better position to work together. So let's look at this painting. Again, some of the problems, yeah, maybe doing it online, of course, is, I want you to look carefully at this painting and answer two questions. What do you see and what do you feel? So maybe someone can, is there an option for people to unmute themselves, Dr. Subhadra, if anyone wants to? Or suppose someone wants to answer this question, can they unmute themselves or can you unmute them?
So they can raise their hands so that we can unmute them.
Okay, so maybe we can, yeah. So please look at it maybe for 1 or 2 minutes, and then please raise your hand and let's hear your opinion. So what do you see in this painting, and what feelings come to you on looking at this painting? And then we'll go from there. Anyone would like to go forward?
So for no one has.
Unnikrishnan sir is there, I believe. So, sir, you want to go ahead? Or maybe anyone, yeah. One problem is I cannot see the chat, the way this is set up, I don't know. But yeah, anyone can go forward. Maybe Dr. Sandhya herself. So what are you seeing in this painting?
So we can see a child lying down with some infection, and a physician has been observing the baby.
Mm-hmm.
The mother is actually tensed and she is upset, weeping, I suppose.
Mm-hmm.
A mixture of both pain and confusion. What is happening? That is the thing which I feel, sir.
Yeah, and what feelings come to you? So you're given a brief description. What kind of feeling does this painting produce?
It is a bit kind of a painful scenery which has been seen depicted over here. So the child not feeling well, mother and father upset. The physician is observing. So a kind of
it's
sad.
more of, thank you. So it's a sorrowful situation.
Yes.
Thank you so much. Yeah. Anyone else would like to add anything? You can raise your hand and Dr. Sandhya can unmute you. Any other things you notice? There are a lot of information. Yeah, we have said some of those. What about, so if you look at it, it's actually an old painting. Yeah? We've gone back in time, maybe 100, 150 years ago. This shows something which is not common these days. So what is not common? A house visit. Remember, doctors making house visits all over the world, it has come down. What about the socio-economic situation of this family? It doesn't seem to be a very well-off family. If you look at the situation, yeah, it mostly suggests, the family is not very well provisioned. They do not have much. Of course, it's a sad painting going back in time. So this is called The Doctor. This is a very famous painting. Many of you may be aware of this, or you may have seen this painting before by Sir Luke Fildes. So it's called The Doctor, and it was painted somewhere in the 1880s. Yeah, so it takes us back in time. So we have a rich tradition of art from Kerala. So I'll also look at, that's one of the questions for you to think about. When I was there in KUHS, one of the questions for you to think about is how much should be international, how much should be local, what should be the language of the module, how much should be English, can we use other languages? And we have to consider the perspective of students from Kerala and students from other countries, also students from other states. So a lot of things to consider, because I believe one of the ways to move forward now is for you eventually to develop your own module. And maybe, we can have maybe broad guidelines from the university, and each college could then use that to develop their own module or whatever, that's up to you. So patient confidence in doctors has decreased. So that is something which has happened over the last 70 to 80 years. Patient confidence in doctors has decreased, and I believe the situation is better with regard to nurses and other professionals. I think one difference between a nurse and a doctor is nurses spend much more time with patients compared to doctors. Doctors just come and go, while nurses usually are present with the patient. So the situation with regard to nurses is not as bad, or not as, the patients have more confidence in nurses maybe than in doctors. So medical or health humanities. So there's no uniform concept or definition. So these are some of the subjects which we usually bring under the medical humanities or the health humanities. Some of these are already being covered. Medical ethics, especially, I believe, is covered here and there. Decision making, communication skill, behavioral sciences in medicine. So some of these are being covered in parts, and I believe recently the Medical Council of India has brought what is known as the 8-core module. I'm sure all of you might be aware of those. I think you're also not just faculty from medical colleges, we also have faculty from other disciplines, maybe from dentistry, pharmacy. So for medicine, that's something the Medical Council has done. So to give a platform to bring these various disciplines together. So this is our definition. So it's interdisciplinary, and we mainly use subjects, like which have been known as the arts. Traditionally, there has been a division, especially in South Asia and in India, between, you either take commerce or you take arts or you take science and go into medicine. So we are bringing back these subjects which have been traditionally known as the arts, and we're using them for specific purposes in medical education. What those purposes are, we will see as we move along. So the term medical humanities was apparently coined by an Australian surgeon, Moore, in 1976. This is widely believed to be the person who introduced the term. He used literature in teaching undergraduate medical students at the University of Melbourne in Australia. So this discipline came about somewhere in the 1960s, because modern medicine has been dominated by science. I think you're all aware of that. Science has brought a lot of good things into medicine. Our medical care, quality of care, everything has improved. But science has dominated medicine, and suddenly the arts have got sidetracked. So to give the perspective of the arts to medicine, that's one of the major reasons why the medical humanities were developed. Human experiences, and we also explore ethical issues in clinical practice. So we mainly use techniques from the humanities. So sometimes, especially in the West, there are a lot of people from the humanities background, people from history, people from English literature, people from philosophy. So they bring their own philosophy to medicine. Sometimes it may be difficult for us from the health sciences to understand what exactly they're speaking about, what exactly they're talking about, because their terminology is quite different. So we look at health from the point of view of a human being. We look at health, but we look at it from a different angle. We look at it from the cell, we look at it from the tissue. Yeah, we are not giving that much emphasis to the human experience. So to bring the human experience back into medicine, that's one of the goals of the medical humanities. So we look at experiences of health, illness, disease, relationship between providers and patients. So these are the various subjects, and I'm just giving a few examples. It's actually a wide spectrum of topics which the medical humanities cover. So shared characteristics, they use methods from the humanities, like I just told you. We use something known as critical reflection. I'm sure many of you may be aware of what we mean by reflection. So reflection is a process where you look back. To put it simply, let's say student has gone to the casualty or the emergency department, first day posting. At the end of the posting, the student looks back and thinks about what she did well, and what are the areas in which she can improve. So reflection is an important area of medicine, and something which is very much stressed. If you look at the latest guidelines, curricula, there's a lot of emphasis on reflection. It's interdisciplinary, and it's related to, but not identical with, the art of medicine. So there are some differences. So let me look at a selection of programs. We look at some developed nations, and then we look at a few programs in developing nations, and especially in India. So this is not by any means I will not be able to cover the entire set of programs. It's very much possible there are programs, a lot of programs which have recently been developed. This is just to give you an idea. It's not a list of programs or something like that. So University of Oslo in Norway started way back in 1996. Art can be a source of personal development. I think many of you are aware of that. So in Kerala, we had, our college arts day, and we got various, let's say, in medical colleges, we got the intermedical. So we knew the role of art in personal development, even though that was not formally stressed or was not a formal part of the curriculum. There were a lot of opportunities, informal, interpersonal opportunities for using art for personal development. So it's an insight into patients' experiences, social, cultural, and historical contexts of medical practice. I'm sure all of us will be aware of this. Yeah, we have our own culture. Patients bring their own culture. Each time a patient comes to see a doctor, or maybe a pharmacist or a nurse, all these are there in the background. And all these will influence the relationship or the interaction between the provider and the patient or the individual. So University of Rochester School of Medicine, a lot of programs have been developed in the United States. Yeah, most medical schools in the United States have some kind of program in the medical humanities. So they offer concentration or a minor. I think this again is something, the concept of electives, I believe, has come, the recent MCI document. So elective is something which a student can take up based on their interest. So we have a core, which is knowledge which every student should know, every doctor or whatever, every health professional should know the core areas, but the concentration of the elective or the minor is based on your interest. So a double helix curriculum is where you start, the basic sciences and the clinical sciences are intertwined, something like the structure of the DNA. You're very much aware the most famous double helix is the DNA. And they have a concentration, or a minor during the 3rd and 4th years. And about 25% of the student body take up this concentration in the medical humanities. Dalhousie University in Canada, again, has a very well-established program in the medical humanities. Broad concept, they offer a number of themes. If you just look at this, they offer so many, something like a supermarket of medical humanities. They offer so many things. And based on your interest and inclination, you can pick up whatever is best suited to you. Someone might be interested in literature. Someone else might be interested in music. Someone else might be interested in writing and storytelling. So based on your interest, you can pick up specific medical humanities topics. I want to briefly talk about theater of the oppressed. So this plays a role. I'll tell you why. So theater of the oppressed was started by a famous Brazilian theater legend known as Augusto Boal. So it's mainly to give a voice to the oppressed people. Remember, a lot of people are oppressed due to various reasons. And we got both external oppressors, maybe people in higher rank, people from a higher socioeconomic group. And we also got a lot of internal oppressive factors. Many of us are afraid to do something new. And many of us want to be, we want to be in the same situation. We have whatever is familiar to us, we want to be in that same situation. So Theatre of the Oppressed, there's an organization in Bangalore in India called the Center for Community Dialogue and Change, who organize a number of Theatre of the Oppressed workshops. So I think about 5-6 days ago, there was a virtual conference on medical humanities. I'm not sure if anyone of you were able to attend that. So in that, many of these points were discussed, and we had Dr. Radha Ramaswamy from CCDC, the Center for Community Dialogue and Change, who talked about Theatre of the Oppressed. I won't go into much of it, but those who are interested can look up. One of the challenges, of course, with the virtual medium is introducing you to some of this will be much more difficult. MH programs in developing countries, again, will look only at a selection. Students can learn from multiple people. So students not just, traditionally, students were learning from their teachers, and maybe students were learning from the seniors. Yeah, I think you know that in medical school, often, many times the advice given by the teachers and by the seniors is in conflict. And often in those cases, many students will follow the advice of the seniors sometimes, so sometimes they'll follow the advice of the teachers. So students can learn from a number of people, patients, caregivers, family. Many of this was already happening. And we used to see patients, we used to talk to patients, we used to talk to patients' family. And from all these people, we used to learn different things. So this one, no, the theater of the oppressed usually is on the floor. And it teaches you to be flexible and non-judgmental, and tailoring our courses according to the local cultures and social values. So that's one of the things which KUHS might want to think about, when they develop a module for the health humanities. How much should it be tailored? How much should the local culture, local social values, how much should that influence the course? And how to make learning fun, because one of the important things is we should keep, these are subjects which, the way they're organized, it's quite fun to learn. And if we take away the fun from these types of courses, then it may not be very much effective. So University College of Medical Sciences in New Delhi, they have a well-established program in the medical humanities. And in the recent conference, which I was just talking about, many faculty members and other people from UCMS did talk about their experiences with the health humanities. They use street theater, they use theater of the oppressed, they have a medical humanities group, and they also publish a medical humanities journal. University in Sri Lanka, which offers an optional course. Again, we're looking at literature. Yeah? So I think many of you are very much familiar, very much aware of this. So in Kerala, we have a rich tradition of literature. So what role should that literature play in a medical humanities course? I believe Dr. Sandhya and the team are looking at, what things to incorporate. They're working actively towards developing a health humanities course. What things to incorporate from art, literature, yeah. Yes, all those things are very much there. Anything you want to say, Dr. Sandhya?
No, sir, you can just carry on, sir, nothing like that.
Okay. What are the teaching learning methods which we can use? Yeah, again, so I said we should keep it fun. And most of the methods which we'll be using are small group learning methods. So one of the challenges, especially for India, and even for other countries, when you got large student sizes, when you got a student body, which could be anywhere between 150 to 250 students in medical colleges. I don't know the situation in other colleges, but I believe even there, you'll have a large student body. So how to break the student body into small groups? What are the logistics? So that's something you may have to think about. So lectures I used. So I'd given a talk. So way back in 2010, there was a session on medical humanities in India. There was a round table which was organized. And even before 1990, so it's a very old concept, yeah. When we were in medical school, they were talking about medical humanities. But one of the, I would have to say the sad things is, not much progress has been made. Because 1990 now is nearly 30 years ago. Yeah, more than 30 years ago, we were talking about how to incorporate this subject into the health sciences curriculum. Interactive discussions could be widely used. Some examples, again, from Riyadh in Saudi Arabia. So Saudi Arabia suddenly has won a lot of recognition for its medical humanities program. They have incorporated the Arabic or the point of view into the medical humanities program. And there have been some good comments about medical humanities programs in some medical schools in Saudi Arabia. And they have been able to tailor this to their local situation. So those who are interested can look up. Of course, in the United States, medical humanities is something which has been around for a long time. And for the United States, of course, nearly all schools have some sort of an offering in the medical humanities. We can use role plays. Traditionally, I've used role plays a lot. Role plays are fun, they're very much effective, and they put the individual in the situation of the character you're playing. Suppose you're playing the role of a patient. You begin to understand what the patient is going through. Or you're playing the role of a family member. What does illness of a patient mean to a family member? Patient doctor course at California, University of Irvine. So usually we start, like advice, they start simple. And then as students progress, we make it more complex. University in Turkey. And role plays enhance teamwork. So if we got an interprofessional, this is something which has not really developed in India as far as I know, where we have medical students, nursing students, pharmacy students, all of them working together. So that's not something, as far as I know, you can correct me if I'm wrong, it's not something which is that common. Maybe KUHS can think about this. Because most of these people tomorrow will be working as a team. So can they learn together as a team? Literature. So some examples, literature has been widely used all over the world. So this is something in Maine in the United States. This is mainly for practicing healthcare professionals. They got a monthly book club. I think this is something which is becoming quite common all over the world. University of Texas, again from the United States, the widely used literature. So it's, so especially in the US, I was telling you, they have such a long history. It's over the United States. I think many schools have been having this program for over 5 decades. So they got a lot of time to develop, to branch into different disciplines. And they offer something during all 4 years of medical school. So if you look at the 8 core module of the Medical Council of India, I looked through that. It has components in different years of the medical school or the MBBS program. So again, widely used in different countries. So we had used it. Again, one of the problems for us is what language. So this is one issue which you may also have to address when KUHS is considering offering a health humanities module. The language of instruction is English. I believe that's true even today. You have students from Kerala. You will have students maybe from other states. You might also have international students. So what kind of language should we use? What percentage should be from English? What percentage should be from Malayalam? What percentage from other Indian languages? And language is a divisive issue in India. I think we know that, because multiple languages, which language should be used, which language should be dominant. And again, one of the other challenges is each language has its own script. So you may not even understand what's written in some other language. So that's again a challenge. So assignment, so this is something when I talk about later about a kind of an assessment framework, again, the whole issue is debatable. We see that assignments can be important, could be one of the methods we use for assessment. Narrative competence, so doctors, so all of us are fond of listening to stories, and I believe that's a human tendency. Something as human beings, we like listening to stories. And the medical humanities bring stories into medicine. Remember, when we were in medical school or when we were doing our programs, the medical programs, we did not have many stories. Only stories which we had were those which were told by patients. Patients begin telling their stories. And as doctors, often we did not have the time and the patience to listen to them. So we used to edit their stories, or we used to cut short their stories. So reflective writing, some of this we already talked about. So reflective writing has been used to teach students empathetic interaction with patients. How do you begin to understand what the patient is going through? It's very difficult, yeah, because we and the patient are occupying two different worlds. If you have to look at it that way, how do you begin to get some insight into what the patient is going through? Personal and professional self-awareness, personal illness narrative. So this is something which has been used. I have also used it in my modules. Any student who is comfortable can share their experience of serious illness, something where they were hospitalized. Maybe as young students, they are much better placed. They may not have much of the chronic diseases, but some of them may have had let's say, an illness, maybe an infectious disease. Some of them may have a trauma, a fall. So if they could share that, concentrating on what it felt to be in that situation. And others can also share, and this sharing creates a kind of an open atmosphere. So we have used this. So this was in Aruba. This was the Xavier University School of Medicine. And this was one of the methods we used for assessing the students. And I'll come to why we should have some framework for assessment. And the whole issue of assessment is a bit controversial here. So this is from Nepal. So this is photography. So this actually was started from the University of British Columbia in Canada. And many of the faculty members from UBC played an important role in establishing a new medical school in Nepal. So this was the Patan Academy of Health Sciences. So this school was actually developed to create doctors for rural Nepal, for the rural areas of Nepal. So they brought many of those techniques from there, from Canada, to this new university in Nepal. So medical and art student pairs, this was in Canada. They create various artwork, and they have heartfelt images, which is an annual context about the heart. Do you want to break for some kind of interaction or questions, and then we continue, Dr. Subhadra?
It's okay, sir. You can continue, sir.
Or anyone wants to ask anything, then we can take up a few questions for some time, and then I can continue with the next part.
Okay, sir. No problem. Participants, if you want to ask any questions, you can ask the questions and clarify your doubts.
Before we move further.
Yeah. Anybody wants to clarify any sort of questions, please ask your questions.
Or you can even share what you're planning with the people, Dr. Sandhya, maybe. What KUHS is planning, or if they're not aware of that, even Dr. Unikrishnan and others. Anything you would like to comment? Because one of the problems with this method is, of course, our interaction is much less, If you're in the same room, if you're physically present, it's much more easier to interact. I find this more challenging. Maybe we are the older generation, but I believe it still has its limitations. There are advantages to virtual, but there are also significant limitations. Anyone would like to ask anything before we move forward?
I think there are no questions, sir. I think we can continue.
Shall I continue?
Yeah, yes, sir. Yes, sir.
So let's look at various teaching learning methods which we can use. So we could use music. So music has been widely used. Yes, sorry.
Yes, sir. So there is one question from Dr. Nalini. She has asked, sir, in Ayurveda we have history. She has said that. She has commented that, I mean, linked to this humanities. Ayurveda, the profession is having some sort of history. So maybe she wants to discuss, or she's written like that.
You can unmute her. Is it possible or not
My
possible?
name is Nandini.
Yes, sorry,
Just
please.
for interaction, my name is. Hello.
Yeah, we can hear you.
Am I audible?
Yeah, yes.
Sir, I am from Ayurveda side, and we have a paper from Indian philosophy and also history of medicine in Ayurveda only.
Okay.
We have that paper in our syllabus. That's what I want to communicate.
Okay, yeah, that's a good thing. Yeah, because I believe, history of, even for medical students, having some history of medicine is always useful. We have traditionally not assessed that, because it's, from where medicine came, where did the Western system of medicine, how did it develop? And what were the other systems? What was the contribution of India? There were other systems. The Western system of medicine is just one system of medicine, even though that's the one which is dominant. There are other systems also there, and people should have awareness of some other systems of medicine also. So music is important. We have a rich tradition of music, which you can draw up, maybe KUHS can think about when you're developing a module. So one university, sometimes you might feel this is a bit surprising. I was telling you, most of the medical humanities programs are from the developed nations, what we call as the developed North. We got programs from the US, maybe Canada, Europe, and Australia and New Zealand. So Argentina, they got a very well-developed program at this university. I think this is a program which started somewhere in the 1960s. So they got a very well-developed program at this university. So Kalos is something which teaches you how to appreciate beauty, again from Greek. It's a course on music and medicine. Of course, we got a rich tradition of dance in Kerala. How to incorporate some of these? Of course, we have our college arts festival and all those things where many of these are, but how to bring this more into the mainstream and how to, most of these were extracurricular, if you have to use the correct term, how to make these co-curricular. That's something you may have to think about. So why should students learn the health humanities? So this is one of the challenges you will face. Remember, we got a curriculum, maybe whether it's medicine, whether it's pharmacy, nursing, there's so many things, and new things. We're learning so much new every day. So can we add something new? Is there space in the curriculum for something new? So refocuses understanding in what it means to be human. These are some of the advantages. So we protect the students' individuality. So students come to medical school as, let's say to medical college as good people, good students. Many of them want to make a change. And this is especially true for medical school. I know medical college. I don't know whether it's true for nursing and pharmacy. So students come with the objective of they want to make a change. They want to do good to society. And what happens by the time they leave medical school? They no longer have that kind of ideals. And the major objective changes. It's how to make money, how to fit into the medical, whatever structure is existing. And many say that, especially in many countries, it's been widely studied in the US, they have found that the most dangerous period in medical school is the third year, when students actually begin to go to the clinics. The time may vary, and the third year is when this change happens. From idealism, they become more money-minded, and the objective changes of students. So medical humanities may protect partially against this. So we get so much of data. I think you must all be aware. Students are told so much, and students get very little emotional support. I believe it's changing now. I don't know how much. It's maybe later someone can talk about that so that I can also get an idea. How much emotional support is provided by the institution, formally, not informally, maybe informally. Many of us can talk. How much is there formally? How much of it is systematized? What kind of counseling, what kind of support mechanisms are there in different institutions? So we see patients from a different perspective, from literature and art, and you identify insights and feelings. Literature can introduce you to unfamiliar and problematic life situations. So that's something which can happen. Drama can, of course, teach you oral communication. Philosophy can teach you the skills of analysis and argument. And we get a glimpse of the whole person. Again, I'm not telling that, not commenting negatively about science. So we're actually reducing a person. Yeah? If we look at science, we are reducing a person down to tissues. We're reducing a person down to cells. And we're reducing the person down to subcellular things within the cell. But an individual is more than a collection of cells. Yeah, I think many of us know that. There's something else to an individual, yeah? More than a collection of cells, more than a collection of tissues. How do we get a glimpse of that entire person? That's one of the challenges. Focus attention on the particular, moral imagination, nurture empathy. So empathy is our ability to put ourselves in the position of someone else. Yeah, suppose we got a patient, who, let's say a patient is suffering from cancer. As a doctor, are we able to put ourselves in that person's situation? Increase clinical acumen. So the virtual conference which was held recently, I talked about how using paintings, it's been shown to improve the clinical diagnostic skills of students. So this has been widely used, especially in the US again. They got sessions where they teach students how to look carefully, and they also then take it from the arts, from painting, they take it to patients. So I started with a voluntary module. So this was way back in 2007. And this was some of the topics which I covered in a voluntary module. So this was from the Manipal College of Medical Sciences in Pokhara. So many of you must be aware of the Manipal group of institutions. Yeah, they have a very well established in India. So in the early 1990s, they established a campus in Nepal, in Pokhara. So this is where I started with our medical humanities programs. And then in a new medical school, our academic leadership recognized the importance, and we had to wait for some time for the process and for the university to affiliate us, to get the required paperwork. And during that time, we conducted a session for faculty members. And then when the first batch of students came, we offered in 2009, we offered our first module for this group of students. If you can see, we are using a lot of small group activities. We use role plays. Yeah, we use maybe presentations. Yeah, so these are the various methods which I briefly talked to you about. And these were the methods which we used in our module. Then at Aruba, so Aruba is an island. It's a part of the Kingdom of the Netherlands. It's just off the coast of Venezuela. So this was a medical school which shifted their traditional curriculum, like multiple subjects. From this curriculum, then we shifted to an integrated curriculum, which was based around organ systems. So first conducted in 2013, yeah. So the first MH module, and then multiple modules were organized. Again, all those small group activities, group presentations. So this was the first batch of students. Yeah, that time it was quite new for many of them. Subsequent batches, we have debates. Here we got other activities going on. And then we had Dr. Rose. So Dr. Rose was my co-facilitator. He was a clinical psychologist from Canada. So he co-facilitated this module with me for a number of years. We use movie screenings. So again, at that virtual conference, which I was just talking about, there are some papers which talked about movies. So movies can play an important role. I think we had the film club, if you're in various medical colleges in Kerala, but that was a student-led, mainly an extracurricular activity, how to bring movies into the mainstream. So we show movies, and then this is followed by group activities and group work. Students in a group reflect on various aspects of the movies, and then there's a presentation, and then we all come together and add other ideas. So this is in the medical school in St. Lucia. So one thing which was new here is you see two groups of students. So these are the nursing students in pink, and the medical students are the one in blue. So this gave us an opportunity to do some interprofessional education. Medical students and nursing students could work together. So this was a module we offered. Yeah, we nearly standardized. We start with empathy, and then we look at what it means to be sick, mainly from the patient perspective. We look at the relationships. We look at the student. It could be what it means to be a medical student, what it means to be a nursing student, what stresses, what factors drive them. And eventually we end with something which is inevitable. At least till today, it's inevitable, all of us will die. And it has been shown that especially doctors are not very much, we have no idea on how to deal with a dying patient. And we'd always try to save life. And sometimes in the process of saving lives, we might cause more harm than what is actually good for the patient. So coming to the issue of assessment, so why we decided there should be some form of assessment so that students are motivated. You remember when you're offering it to the entire student body, which is something you may have to decide on, maybe KUHS and the various constituent colleges, how to keep students motivated. So having some kind of a simple assessment, they come to the sessions, they participate in the sessions, that's enough. And as a facilitator, you're able to look at their participation and maybe give them some grades. And then we have some reflective writing assignments. So based on this, you get a kind of a rubric to grade the students. So this is something we use. We use a simpler version of it now so that you find it easier to grade the students. Again, from Kerala, some of the things. I think many of you are very much familiar with this. I look at something, this is a Canadian artist called Robert Pope. So why I use the art of Robert Pope is, Robert Pope was an artist who died from cancer. He died very young, somewhere in his 30s. So especially when you're exploring what it means to be a cancer patient, the social dimensions, the personal dimensions, Robert Pope is a very good artist. Most of his artwork is freely available. Nearly all his artwork is freely available. So we have used a lot of his artwork. So take 1 or 2 minutes to look at this and let someone tell us, what do you see in this painting and what do you feel? The same thing which I did with the painting sometime before. So take a minute to look at this painting and then someone can volunteer. Anyone who would like to volunteer? What do you see in this painting and what feelings come to you on looking at this painting? So please go ahead. Dr. Sandhya, anyone would like to talk about this?
Anybody wants to talk about this painting? Participants, please observe the painting and just raise your comments.
There are some things which are peculiar about this painting. Please.
One madam has raised.
Yeah, please go ahead. Introduce yourself and then let's hear you.
Mercy ma'am, you can just unmute and you can just pass your comment.
I think the person is touching the patient with the empathetically.
Any other
Hello.
comments? Yeah, we can hear you. Yeah, please go ahead. Yeah.
Ma'am,
Any
please,
other things?
ma'am, please introduce yourself to sir. Mercy ma'am, can you please introduce yourself? Mercy ma'am is actually a nursing madam, a faculty of.
Hello, I am Dr. Mercy. I am Dr. Mercy.
Yeah, please go ahead,
To me,
Dr.
this
Mercy.
picture appears that the patient, the nurse is touching the patient with a lot of empathy. So there is a power of touching.
Okay. What kind of
I
painting
feel
is
so.
it? Is it happy painting or a sad one?
It gives a sad moment.
Because of the colors and other things. Anything else you notice which is peculiar about this painting?
Yeah.
Any other comments?
The windows are the windows of the room is open. The windows of the room is open.
And it's, if you look at it, it's drawn from someone.
I can only see this now.
Yeah. It's drawn from the perspective of the patient who's lying down on the bed. Yeah, remember, this is a patient who's on the bed. We don't see many paintings from this perspective. Someone who cannot walk, someone who is bedridden. I think we know those kind of patients. What does being bedridden, what does it mean? Yeah, how does it narrow the perspective? So all this you can see very much in this painting. This is something by, yeah.
Sir, one more professor, Dr. Rajmohan sir has commented the power of touch as power of touch. Yes, sir.
Again, I think maybe this may be a caregiver, a family member, and someone is sick for a long period of time. What will that do to the relationship? Yeah, remember, a lot of these relationships will come under strain when you have to take care of someone every day, 24 hours a day, 7 days a week, for a long period of time. A lot of stress also happens on the caregiver. Let's look at another painting now. Any comments on this one?
Participants are requested to kindly observe the painting and raise your comments.
Again, this is by Robert Pope. Again, what kind of painting is it? Again, it looks like a sad painting. If you look at the colors, most of it is sad. Anything else? Any other observations? What is dominating this picture? We got some syringe, yeah? We got a syringe.
Rajmohan sir has commented, frightened of seeing the injection.
That's the injection, whatever is there in the syringe is dominating. Yeah? That's very much in the foreground. What about the patient? If you look at the patient, any comments? Patient is maybe protecting. Yeah? Most often people say this is a lady, even though there's no indication of gender. We have used it multiple times. Nearly everyone says it's a lady. Yeah, so
because of the color of the blanket and the cap.
Maybe pink for ladies. Yeah, maybe. Yes, that could be possible. Yeah. Cancer patient, of course, alopecia, loss of hair. Patient is maybe protecting herself. Let's assume it's a lady. Patient is protecting herself, maybe from whatever there is. What about this one? Any comments on this? Again, maybe a cancer patient. We don't know who is the patient actually in this. Yeah, we don't know where, in whose wrist or wherever, whose vein this IV infusion is going. Yeah, that's something we are not definitely sure who is the patient. Yeah, and who is comforting whom. Yeah, but again, it shows hope. In the face of adversity, in the face of illness, there is still hope. So let's look at how to measure the impact. This may be the last major topic which I'll be addressing. How to measure the impact of the medical or the health humanities. So often we can use qualitative methods and we can use quantitative methods. So It has been shown to increase empathy. Remember, when we talked about the advantages, we said medical humanities improves empathy. So what's the evidence? We're looking at some of the evidence. The evidence we have is not complete. The evidence we have has a number of drawbacks, which we'll look at shortly. So empathy, improved levels of empathy. So students who took a course in literature and medicine, they had improved levels of empathy. And this is one of the scales which we can use to measure empathy. Professionalism, again, improvement in professionalism. Physician well-being has improved. Yeah? Again, some studies show that less depression. Improved communication. So all those things which we want our medical students or our health science students, all those things are happening. So students, again, multiple studies were done. Overall empathy and insight, all these were improved. Fine art. So this is what I talked about in the virtual conference. So fine art has been shown to improve the visual diagnostic skills of students. And here they had a control group, just like any other trial. They had a control group and a group who underwent the arts-based intervention. So they found that students who took the fine arts course had better diagnostic skills. So challenges, of course, it's not very easy to measure. We're talking about things which are not easy to measure. Things like empathy, professionalism, yeah, communication skills. Many of these things are not so easy to measure. Most of our data is either short-term or medium-term. We don't have evidence of long-term impact. Let's say if KUHS offers a medical humanities module today, is it possible that 10 years in the future, students will be better? The students will be better healthcare professionals compared to those who do not have a health humanities module. Studies are different, interventions are different, target populations are different, other variables, and we're looking at so our ultimate objective of medical education or health education is to improve the health of patients. And we're looking at other measures. We are assuming that if empathy improves, patients will have better outcomes. If doctors are able to communicate better or nurses are able to communicate better, there'll be better health outcomes. But how do we measure directly health outcomes? How do we measure, let's say, quality of life? Or how do we measure life expectancy? And will health humanities have any impact on these parameters? There are a number of confounders, gender, age. Yeah, so we're looking at students. Each student may be different. You might have students who have done a degree. That's possible. Your students who have had different life experiences. We've got students who came from urban area. We've got students who come from rural area. So student factors will also influence how they perceive and how they interact with the humanities. So many of these were electives. So students actually choose to participate. So someone who is choosing to participate in something, it's very likely that he or she will have a more positive opinion. Yeah, if you select a subject, it means you're more positively inclined towards that subject. So I had given a video lecture series. So this is actually under a group known as IGI Global. I think it's a paid resource. So if it's a detailed introduction to the medical humanities. So KUHS could try to maybe talk to them and try to get a special prize for access. So that's broadly what I wanted to say, and I can take a few questions, or maybe I can listen to what KUHS is planning and your perspectives. So that's mainly from my side, yeah. So let's open it now to questions, comments, and observations.
Thank you so much, sir, for your very informative talk. You have delivered the talk in an extremely interesting and an effective way. Now the platform is open for question and answer sessions. Participants are requested to kindly raise the questions and clarify them.
Experiences, yeah, whatever you want to share.
So I have a doubt to be asked, sir.
Yeah, I will try and answer if I can.
Narrative medicine and the graphic medicine. What is the difference between these two, sir?
Graphic is more, very more visual art, what you call that, comics, the comics and illustrated, those. I think we have a lot of comics, Superman, we have Amar Chitrakada, and so many other comics. Graphic medicine uses more, what you call, along with words, it also uses drawings and sketches. Narratives is more, it could be either written words or it could be someone telling their stories. So narrative, the visual component is usually less, depends somewhat more on the imagination.
So the modules are usually conducted for students in their first year of education, or maybe throughout all the years of their course, or maybe towards the end.
When I was doing it, I could only offer it for the first year. Of course, due to various reasons, but it might be best if you could offer it throughout the course. Of course, that puts a lot of logistics and other requirements. So if you have the logistics and you're able to fulfill all those requirements, it may be best to offer it throughout. But again, it depends, because creating that kind of people, creating people who are interested, and again, large batch sizes, yeah, which is something you may have to deal with. And again, large group methods may not be so effective. So you may have to break students into small groups. That means multiple sessions. So a lot of those factors will have to be looked at.
Okay.
When KUHS goes ahead and decides to offer it to the constituent colleges, at a college level and at a university level, these are many of the questions which will have to be considered.
So there's a question from Dr. Rajmohan, sir. Sir has asked, dear sir, have you come across any resistance from teachers and what are their criticisms?
Because one is we did not involve others, maybe because of the sizes and other things. It was mainly 3-4, maybe 2 of us in the Caribbean and maybe 5 or 6 of us in Nepal. So they were not actually involved in facilitating the module. Yeah? Those who were facilitating were people who were interested in medical humanities and were aware of this discipline. Resistance sometimes from some people, because when you're asking for curriculum time, you're asking, say, 2 hours a week, let's say maybe 14 hours or 16 hours in a semester or something. Some people might ask, what exactly are you doing? Is this time which you're asking, is it worthwhile? Because ultimately we're taking time from other subjects also. Yeah, maybe. So some faculty feel that time could be better spent maybe teaching the science of medicine. So not resistance as such, but sometimes, yes, especially, I don't know, the situation might vary in different places. So it's possible there may be resistance. That's something you may have to be prepared for. That's what I would say.
Sir, one thing is that it has been said that by learning this health humanities or medical humanities course, we can infuse joy to learning. Is it correct, sir?
Depends on the techniques which we are using, yeah, because, if there's many of the small group methods, role plays, art, all those actually are fun. But if you if you take away that fun, then of course, then it might be, if you just go ahead and deliver a lecture, we just give a lecture about paintings, then that may not be so much fun. And this is an issue, I think, the recent conference which I attended, how to preserve the fun nature, because without the fun, without the student involvement, it becomes just like any other subject. Yeah, I'm not criticizing any subjects, but often we feel the subjects are the way it is approached is too didactic. So it depends on you as teachers and facilitators, how you can preserve the fun nature of the medical humanities.
So can you highlight the difference between medical humanities and health humanities? Sir? Like now it is.
Now the term they most often use is the health humanities. That's again because we traditionally started being offered to medical students. So that was the first population to which this discipline was offered. Yeah, medical students were the people, and even now, and then of course today we have interprofessionalism, we got interdisciplinary. These are concepts which have become very much powerful, especially in the West. Yeah, so students learn together. So they felt this term is too narrow. The term medical humanities is too narrow, and the same concepts and ideas are applicable to other, not just to medical students, but also to nursing, complementary medicine, Ayurveda, so homeopathy, pharmacy, whatever students. So that's how the scope was expanded. And the term which is more often used today is health humanities.
So there's a question from Dr. Nandini. Madam has asked us, sir, shall we get time in between our syllabus? It's difficult to finish the portions, whatever syllabus we have. So in between, whether we will get time to conduct these kind of courses.
That's a decision which, the university and you might have to take. One of the challenge, of course, is, there's the knowledge is increasing. That's something I told you. The science, the knowledge is keeping on increasing. New things are coming. So how much to stress, where to stress? Because I believe, and increasingly the consensus is that this is not something which is optional. And you teach only the science of medicine. You don't create a well-rounded healthcare practitioner. So the arts are very much required. So the arts, there's a time should be found for the arts, for the medical or the health humanities in the curriculum. That's something for for you people to sit together, maybe at an institutional level, at a university level, and see how time can be created. And sometimes, I think some of the accrediting agencies also now want some amount of learning in this aspect also to be present. But that's a very important question, and something which you might have to approach at an individual, institutional, and maybe at a university level.
So we have different courses, whether the same module can be applicable for the different healthcare courses.
For some of them, I believe, yes. Again, my experience is rather limited to nursing and medicine. Suppose, let's say if you're offering it to, say, Ayurveda, you might have to make some changes. Maybe the broad things will be the same, like empathy, the relationship, what it means to be a patient, death and dying. Broadly, I believe most of it will be the same because we're talking about the human condition. Some aspects might be different. There might be some differences within, but the broad areas which will be addressed, I believe, will mostly be similar.
Any more
else?
questions? Any more questions to be clarified from the participant side? You can ask questions. So there are no more questions.
Let me stop sharing then, I believe. Yeah. Shall I stop sharing?
Yes, sir. Yes, sir.
Okay.
So, since there are no more questions, I would like to conclude the session with a brief vote of thanks. I take this opportunity to thank our Honorable Vice Chancellor, Dr. Mohan Kunnamal, sir, in his absence, for giving me an opportunity to conduct this webinar. Thank you, sir. I sincerely thank our Pro Vice Chancellor, Dr. Vijayan sir, for your kind advice and timely help rendered. Thank you so much, sir. I'm grateful to our Registrar, Dr. Manoj sir, for rendering all the support for the conduct of this webinar. Thank you, sir. I sincerely thank our resource person, Dr. Ravi Shankar sir, for the excellent talk given. On behalf of the Center and Kerala University of Health Sciences, I extend my sincere gratitude to you, sir. Thank you so much. My sincere gratitude to our Dean Academics, Dr. Unnikrishnan sir, and Dean Students Affairs, Dr. Iqbal sir, for all the support. I take the opportunity to thank our systems manager, Mr. Harilal sir and his team, as well as Joint Registrar, Mrs. Geeta ma'am and her team, for all the effort and timely help. Finally, I would like to take this opportunity to place on record my hearty thanks to all the participants who actively participated and made this a successful event. Thank you one and all. Have a great evening. Thank you so much, sir, for this wonderful talk. Thank you, sir.
Thank you.